So I'm going to take some from Nookies, but some from Wendy. Wendy does a beautiful job. If you haven't subbed to her, go over and sub to her. Best playlist in the world. What I find interesting is that the one we're going to watch, the new UTI story, okay, filmed on the 13th, she claims that she was not on TikTok from the time she got discharged the 7th until that Sunday. And I beg to differ because she was on the 8th. Yeah. That was when I was saying she looks like shit. And she did, and she went back in. But yeah, she claimed she wasn't on TikTok. And obviously she was. She must just have her calendar mixed up. Or she also said she wasn't going to be back on until Saturday. And as we can see, she's back. She's been on several times today. Because it's Dani, we're going to look at the transcript. This was just a funny.
Music, what is your favorite genre? I would say...
What was that? General? What was that?
Music, what is your favorite genre? I would say...
I found the part about the softball interesting. I know she blamed the paparazzi for ruining her softball career. I thought this was a competitive team because she talked about how they were going to have team matches and the girls were real serious and all this stuff.
The best at it because I haven't played in like forever, but whatever. I love softball. I mean, I did. I used to play for 15 years, like when I was younger.
So if she's 32 and she played for 15 years, and you don't generally play softball until 8th grade, I mean, usually you're too small to hold the ball before then. So then she never stopped playing, did she? Now this I just found interesting. When you're speaking about your adoptive mother, just an odd thing to say.
When I was younger, so good, you're doing better. You look so much better. Thank you so much. I appreciate that. I really, truly am. But yeah, I am doing much better. I am. I'm healing, and I am trying to get back to my normal self. Where did Enzo go while you were gone? So he was here. Mimi decided to step in for me and help me out. So that was very genuine. That was very nice of her. Enzo did not like her at all. I was FaceTiming her, and she goes, Dani, he's not letting me get to the water. And I'm like, so she had to like shut him. Beyond grateful for her. I really, truly am. She has helped me out tremendously. She was very supportive when I was in the hospital. And it was awesome. So I'm really glad that she was by my side helping me and being there for me. So that made me very happy. And then amazed, and like I get that my family, like I don't talk to my family, and they knew what was going on. And my birth mom, Lisa, called me, and it rang, and I was crying on the phone. I was crying on the phone to a lot of my family members because I was scared. And I was very emotional, and Lisa called me. My entire family called me, and one of my aunts was, I asked her, I said, please, can we pray? And she did a powerful pray for me. It was amazing. It was an amazing prayer. And, it was amazing. And I was so happy. And then a couple of my other aunts were praying for me as well, and saying, we love you, Dani, we're here for you, just continue getting better. So, getting that emotional support was just amazing. It sucked because, I wish they were there more for me, but, of course, it had to be at that low, it's like, if I'm in this predicament, you're gonna reach out for that, but it doesn't matter. Yes, I was septic. Not septic, I'm sorry, septis.
And we're continuing with septis. It's really sad when the closed captioning calls it septis. It is sepsis. It might be hard for her to say, But yes, she was septic if she had sepsis.
Talk about a lot of things because I know a lot of people know, but yes, I was, and I was very ill. I was very sick. My face was like very swollen.
Swollen.
I looked like I gained like 20,000 pounds. I was very weak. My left side was just like horrible.
What does that mean?
But
Paralyzed,
yeah.
swollen?
It was scary. I'm just gonna say that much. It was very scary. But I had, and I said, I am so grateful, that two of my, two people that stood up and it gave you guys updates. I'm very glad for them. I am. I'm very, very, very happy that they stepped up and they let you guys know because I needed the prayers and that's why I did it. And I am just, the power of prayer is so amazing.
Wait.
And I stepped up and they let you guys know because I needed the prayers and that's why I did it.
That's
and
why she did it.
Just, the power of prayer is so amazing. And I know my supporters, that's why I did it because I knew my supporters would come to my rescue with prayer. I just knew it. And it's just an amazing feeling to know that the power of prayer and everything. And then I had a lot of people texting me, not a lot, I wouldn't say. And I did, I have to say, I just want to say thank you for respecting.
She speaks higher of her supporters, her two supporters, than she does of her family. Because she just said her family were calling her. Texts were coming in. Everything was coming in. When you are seriously ill, you're not on your cell phone. Believe me, you're not.
I got 9 minutes and I got to jump off, guys, for a little bit. But at the end of the day, I'm here. And like I said, it wasn't, it was serious, but I'm just so happy I caught it in time. I am. I'm so happy. I really am. Oh, but whatever. And then
Oops.
I'm like, it just brought tears to my eyes to see how sick I really was. And like, it just, yeah, it was horrible. It was horrible.
So she's taking selfies in the hospital because she wanted to see how bad she looked. I think that's just kind of weird. Thank God I never had a patient that did that. So now Dani's going to launch into how you get a UTI.
How does someone get it? So UTIs, you can get them from anything, okay? And I mean anything, okay? You could be sitting and not doing, oh, thank you for subscribing, appreciate that. You could be just sitting down and getting a UTI. There are many ways that you can get a UTI infection.
I just want to hear that one more time.
Thank you for subscribing, appreciate that. You could be just sitting down and getting a UTI. There are many ways that you can get a UTI infection. Especially in women, it is very common. It is very, very common. Yeah, bath water. But yeah. So, and like I said, like most of the times you don't know that you have a UTI, and that's the scariest part.
Okay. Sitting down does not give you a UTI. She is correct that women tend to get them more. That's because our urethra is shorter. And somewhat on it about the water thing. But let's continue. I do want you to remember, she said she had no symptoms. She didn't even know she had it.
It's horrible. And yeah, sitting on cold things. I mean, there's just multiple things, okay? And so the UTI, like you can get antibiotics. Like if you have a UTI, you need to get on antibiotics immediately. And I mean immediately. Like there is no joke, okay?
Chef Carl.
I'm telling you, okay? like legit, like you need to be on antibiotics. If you don't, and you just whatever, it can go into your kidneys. It can lead into a kidney infection, and then that can get into your bloodstream, and then you will go septic.
Yay!
So that's pretty much it. I'm just like, I had a UT once and was shaking, so it was so bad. Mm-hmm.
Someone wrote that.
Yep. See how I'm not shaking as much? Mm-hmm. Like, I can't tell you how bad, oh my God, it affected your white blood cells. Oh, yeah.
Oh, yeah.
Dani, I don't know who you are, but hi. Yes, I have UTIs all the time because of my blood disorder. I don't know who you are, but I've been here. I mean, now some people have UTIs and can't get rid of them, and they have to be on medication for a while. And I'm still there. Okay, it's not gone. I don't know why, but whatever. I have to figure it out. But it is what it is. You know. Please don't ever just be like, oh, it's just a UTI, whatever. Like, no, please don't. I literally did not realize I had it. Like, I had no idea until I was like, that was the one. Like, so like, I was like really not feeling good. I was lightheaded. I was dizzy, and I knew something was wrong. And I was like, okay, I don't know what to do here. Like, I felt very weak. I felt like, okay, like, what is going on? And then I'm like, I have to go in. I do. So I went in, and my blood pressure was 80/60. Okay, 80/60. That was the day that they literally said, oh my God, you have a UTI. And I'm like, so then she gave me antibiotics. Well, it didn't work. So I got worse. I went back. The infection got worse. Okay. And then went home with new antibiotics. Wasn't working. Well, then I wasn't drinking. I wasn't eating. I was shaking. I was just all over the place. My brain was confused. I was very just dehydrated, laying in bed, sleeping. I just didn't care. I didn't care in the world. I just wanted to lay there and not move a damn thing. Finally, Mimi came to my rescue and says, we're pulling you out. Let's go. No, you're going. I'm taking you to a different hospital. You're done. You're going. So I went. I was in the trauma unit. And it was very scary. I'm just going to say that. I was not septic at that time. They ran my blood. Everything was fine. They did CAT scans. Everything was fine. Not a big deal. It was just a really bad infection. But they had to give me IV antibiotics because the antibiotics weren't working. So I had to get IV ones. So then I proceeded to stay there for a couple of days. And then they dropped me down to PCU, which is a drop down for trauma patients. So like that is the next level to be discharged. So, and they moved me for another reason, but whatever, we're not going to get into that. So they said that it was already gone. They fixed it. I was ready to go. I was feeling better and everything else like that. Well, they didn't give me any antibiotics to go home with. Well, I wasn't on TikTok. When I came home Sunday through Wednesday, I think it was, I was sleeping constantly. I mean, I just wanted to sleep. I couldn't move. I just could not move. I was just a zombie. I couldn't. And
remember how she said she didn't have symptoms? Okay, here we go.
So then I got up. I went live with you guys, and then and then I of course I had burning. I mean that's just I was in pain. And then my face started swelling up really bad. And I felt something off. My back was hurting. My lower back was killing me. And I'm like, there's something wrong. There's something going on. And so all of you guys were saying, oh no, go to the store and get this and go to the store and get that. It will help you. And I'm like, when I got off, I'm like, okay, no. I'm going to do this. I'm going to call my primary. So I called my primary. I went in. Okay. I'm glad I did. I wanted to get retested because when I was at the hospital, when they discharged me, they told me that it was gone. Everything was fine, whatever. Right. As soon as I went to the doctor, I retested it. They found blood in my what, and then I was infected really bad. My doc looks at me and says, "Hey, you need to go back immediately. You do." And I'm like, "Why?" And he showed me the results. He said, "You have blood in your whatever." And I never had that before. So I went to the hospital again, and they took me in the back right away. And then my white blood cells was at 28,000 or whatever the case may be, 28 whatever, and it was very, very high. And at that point, I was septic, I believe. So they decided to put me up into a room. It was not a trauma unit. It was not an ICU unit. It was just an isolation room that I was in. So I just want to just clear that of the way. So, but I was there, but that's my story. Now you guys know that. But I just want to just spread awareness. Just please take care of your body. It was not fun, and it was very, very. It was just horrible for me. So
Okay, let's unpack it. Here we go. Yes, you need to have antibiotics and usually a bladder spasm medication like Pyridium if you get a UTI. You cannot cure an UTI with cranberry juice. You can't do it with azo tablets. None of that shit. Believe me, you need antibiotics. And the reason for that is you don't know what bug is in there. It could be any number of bacterias, from E. coli to staph to MRSA, you name it. So that's why you need to go to a doctor and have them test it, okay? Women do get more. We are prone to UTIs simply because our urethra is like 3 inches long, right into the bladder. So it takes less time for a bug to just go beep and walk up there. Some people have a predilection to getting UTIs. You can have any number of syndromes and conditions, diseases that predispose you to having them. People who are paralyzed tend to get them. People who do not drink enough water can get them. Men are a little more fortunate because their urethra is much longer. It can be like 7 to 9 inches going up into their bladders. So it takes the bacteria a lot longer, and generally it gets flushed out before it reaches the bladder. Now, if your bladder does get infected and you don't get symptoms, about 40% of people do not get symptoms. You will not get frequency of urination. You will not get burning. You will not get any kind of discomfort, cramping. And yes, then it can lead into pyelonephritis or a kidney infection, and that can be very serious. You can lose part of your kidney. You can lose a total kidney. You can end up on dialysis. It's not very common because generally people will get some kind of discomfort with a bladder infection. Even if you don't get outright burning on urination, you will be annoyed by the frequency, or you will get the bladder spasms, and they're uncomfortable. And so it's uncomfortable enough that you should be going to a doctor or at least an urgent care. And a quick dipstick test is going to tell you if you have one, and then they can send it to the lab to see what bug it is. In the meantime, they'll give you a broad spectrum, usually like a Septra, Keflex, and 9 times out of 10, it's going to help. If the lab report comes back and it's a different bug, then they may switch your antibiotic. But generally, that's all it takes to stop it. Now, If it progresses and it gets into your kidney, generally you're going to be admitted. You need IV antibiotics until that is clear. You might need to have an IVP done to see if there's any damage. You end up on a med surg floor, and then you're out in 2-3 days. That's it. You go home with antibiotics and some Peridium, some pain meds, you're fine. If it progresses from that, it can lead into sepsis. Now, our sepsis TED Talk last week, we discussed the 3 forms of sepsis. It's not called sepsis. I don't know why she insists on calling it that, but whatever. If it progresses into sepsis, that's a different story. Then you're going to be in there for several days till the sepsis is clear. It takes 72 hours for a blood culture to come back. So they need to know what kind of bug is in you. And in the ER, we would draw blood cultures. You take them from both sides of the body. You get 2 bottles for each side. And those bottles grow in a medium, whatever bug there is, and it'll tell you. Then you can use a targeted antibiotic to clear up that specific bug. I don't know about that blood pressure. I'm sure it was low. I'm sure she was dehydrated. I'm going on what she showed. And I don't know why someone would lie about having sepsis, but 28,000 is not going to blow me away. That can be the white count for appendicitis too. So, when you see I had a child in ICU that had a white count of 72,000 and who ended up passing away. We flew him out to Davis, but he had new onset leukemia and he had ALL, as I recall. Just a little dude, like 2, and we didn't even take peds, but the other hospital was on diversion and we had to take him. And he was pretty much just in there to hold for Davis to get a pediatric ICU bed. And his lab counts would come back. Now that's, you see a white count of 72,000, you're like, holy crap. 28,000, I'm not going to, I've seen higher in the ER, and it was generally peritonitis or some other abdominal infection, liver infections, abscesses inside the abdomen, bowel death, stuff like that. Yeah, you'll get really high ones. We went over it affects your white blood cells, is what somebody put in the chat. As I said, you never make a diagnosis of sepsis based only on your white count. Anything under 4,500 and anything over 11,000, 12,000 is considered the beginning form of sepsis. That's kind of a broad thing though, and so you'll have other diagnoses underneath that pinpointing origin. So you would have a bladder infection, pyelonephritis, and sepsis. Plus, she has asthma. I mean, she came out with a horrendous cough. She always has had a horrendous cough. She has seasonal allergies. She has asthma. She's a smoker. These are all, so she has COPD. Even if you don't have the symptoms, generally, they're going to mark you as, if you're a smoker or a vapor, they're going to mark you as COPD. You never base sepsis on white blood cell count, ever. It takes several different lab tests to form a diagnosis of sepsis. All your white blood cell count shows alone, and I'm not talking with the shift, I'm not talking with the differential, nothing. All it shows is that you are overproducing white blood cells because your body, they are trying to attack a foreign object, being a bacteria. Okay, so in response to a bad guy coming inside your body, anywhere, in your bladder, in your eyeball, in your fingernail, it doesn't matter. your body is going to produce white blood cells who go out like a little army to the place, and they all gather there to try and eat up all the bad guys, all those bacteria. And your body's going to keep producing white blood cells to keep fighting as long as there's an infection. And that's why it will grow bigger and bigger and bigger in number. Now, sometimes our bodies go wonky. Like if you have leukemia, there's all kinds of diseases where your white blood cells or your red blood cells or your neutrophils or whatever will overproduce or underproduce. And yes, in combination with other lab values, you can make a diagnosis. But you don't base a diagnosis on just white blood cells. All right, so some people have UTIs and can't get rid of them. That's true. There's interstitial cystitis. Those patients generally have a bacteria inside the lining of their bladders at all times. It's a very painful condition. I mean, horrendously painful, and it's difficult to remedy. They pretty much just keep you on medications and pain meds for life. But there are several different conditions where you are prone to getting them. And it's not technically that you have a constant bladder infection. I mean, paraplegics can, quads can, but anyone that's low mobility, wheelchair bound, anything like that, they're prone to it. And that is because of hygiene. It isn't technically because of sitting. It's because of hygiene. Because when you're sitting or less mobile, you have less sphincter control. And so you tend to leak a bit. And sitting in a pad, sitting in a diaper, even being naked on a chucks, just having urine leaking, urine inside the body is sterile. As soon as it hits oxygen on the outside, it fills up with bad guys. Okay. So unfortunately, then the bad guys are on the outside on the skin surface and they go running up. And if you're female, you're screwed. Oh God, that came out wrong. Seriously. Sorry. Let's see what's next. Well, Dani doesn't have to figure it out. The doctor needs to figure it out. But now, she's right about don't ever say it's just a UTI. You should go to your doctor. That's true. I can't make a diagnosis, but the thing about the antibiotics is confusing. Okay, so she got antibiotics going in the first time. I guess she utilizes the ER as an urgent care, or she says primary care, but it gets confusing. So she gave her antibiotics. So that's antibiotic 1. It didn't work. I got worse. I went back. Infection got worse. Went home with new antibiotics. Now that's unusual. She should have had her lab. Well, no, she could have gotten the labs back, and the doctor, I'm assuming it's a female because she says she, or if she's in the ER, whatever. They looked it up and saw that the urine came back with a certain bug. I don't know. And they switched the antibiotics. Okay, I take it back. No. I'm thinking of a doctor's office because to me, that's the normal thing to do. Call your doctor and say, hey, look, I need to come in. They'll make room for you. And the new antibiotics weren't working well. Well, then I wasn't drinking, wasn't eating, I was shaking. Well, she's dehydrated. She's malnourished. Well, I was all over the place. My brain was confused. Okay, so she's those are symptoms of beginning stage sepsis. So laying in bed, sleeping, didn't care. Okay, so Mimi comes to the rescue, but she just was kind of like dismissing her. Thank God I had her. She came and took care of the cat, and the cat didn't like her. My supporters were just Awesome. What? Your grandma came. You're going to a different hospital. See, that's what I don't get. So, by saying that, she's utilizing the ER as a primary care or an urgent care. So, I don't know how many hospitals there are in her area, but it sounds like she goes to all of them. So, they go to a different hospital. And she would not go to the trauma unit. I'm sorry. She would not. Even if you are stacked up, you never take up trauma ICU beds. You just do not. Sepsis, you can treat on any tele bed, tele floor, step down unit. You're not going to take an actual trauma bed, especially in a city. You're just, Florida? No, you're not going to. She went to the trauma unit, and then I'm just going to say I was not septic at that time. They ran my blood. Everything was fine. They did a CAT scan. Everything was fine. Not a big deal. It was just a really bad infection. They would not use a trauma bed for IV antibiotics. I'm sorry. And if she wasn't septic at that point, no. She would not. There's something else then. Something else. Because no. You just don't. I'm sorry. Those beds are kept open for a reason. So now, here's one thing. If she came in for something different, there are shock trauma units. Okay? They're different than trauma ICU. Now, sepsis, if you're going into septic shock, yes, then you're going to get a shock trauma bed. They still don't give those away just for IV antibiotics. A UTI, even a kidney infection, is not going to take up that bed. They are specific beds. Okay? Worked in ICU long enough. So then she goes to step down, which is a drop down for trauma patients. But she wasn't a trauma patient. Next level to be discharged. As I've said, I generally get discharged at a step down. So you can be discharged at a step down. It's not a problem. If you're new here, I explained how my ultra rare condition, I end up in like a shock ICU, CVICU, CCU bed for 72 hours to a week. And sometimes I'll be in ICU for 4 or 5 days, and then they'll drop me into step down. The difference is when you are in ICU, your nursing ratio is 1 nurse to 1 patient or 1 nurse to 2 patients. That's it. Because those patients are so critical. In a step down, it is 1 nurse to 3 to 4 patients because you're not as critical. And you generally can be discharged out, or you can be discharged to a med surge floor for 24 hours. They moved me for another reason. We're not going to get into that. That tells me she was there for something different. There was more than just the UTI going on. They were treating her for. And she, for once in her life, she's keeping her mouth shut. So then I was feeling better, everything else. They didn't give me antibiotics to go home with. Okay. Now, that line has been consistent. And I said from day one, that was a lawsuit. That's a lawsuit waiting to happen. I've never heard of somebody who is admitted for a UTI, a pylo, and didn't get sent home with antibiotics. Period. So then she's just wanted to sleep. She wasn't well. She looked awful. Yeah, she did. Now, here's the thing. Remember how she said she didn't have symptoms? And then she says, oh, yeah, I did. Of course, I had burning. I was in pain. But you just said you didn't get symptoms. I felt something was off. My back was hurting. Low back. Killing me. Something's wrong. I remember in that live stream people telling her to go to the doctor. But I guess people were telling her to go to the store. She goes to the doctor. Just because you have blood in your urine does not mean you have an infection. He went over her labs with her, but he's not asking for her opinion. And the way she says it, it sounds like that. He showed me the results. And that's when her white count was 28,000. Okay, so here's what's interesting. I wasn't in a trauma unit. I wasn't in ICU. I was in an isolation room. Okay? So she's been on 2-3 rounds of antibiotics. She's had IV antibiotics. It's not gone. Her white count's gone up. And she's now in ISO. I'm going to say it's MRSA or VRE. Because you don't put a septic patient generally with a high white count into ISO. That's generally for people that have something that is possibly spreadable. Just my opinion. But I've seen enough sepsis that no, they don't require ISO unless they are low white counts. Then they're open to infection. If your white count goes below 4,000, you are open to an infection. So they'll put you in ISO to protect you. And she's going to spread awareness, and it's awful. Now, what's interesting is that in the next video, we're going to go over the next one, which was from today, where she goes into the hernia. Oh, I think it was last night. I'm sorry. The 14th, where she goes into her hernia and discusses her MRI, her CT results. Yeah. Yeah. But interesting. Whoever the hospital was that sent her out without antibiotics, I would never go there again. Never. I would tell my enemies not to go there because something ain't right with that place. It could have been an oversight, and it could just be Dani saying it. But if they really did that, that is just horrible. Yeah, so we're going to get more into UTIs, but happily she's home and she took a walk and she's back doing all her Dani things. She wants to get back to dancing and singing. I guess a job isn't in the horizon. Hope Mimi paid the rent.